Hello and welcome to Health Insider with Mario Toneguzzi on Megapix Media. Joining me today is Dr. Christine Molnar, who is immediate past president of the Alberta Medical Association, and Dr. Michael Giuffre, who is the Alberta nominee for the president-elect position this year with the Canadian Medical Association. Thanks, both of you, for joining us today.
Thank you.
Let me start with you, Christine. When you look at Dr. Giuffre and over the years, you've had a lot of leadership roles in the province. Tell me what led you to support him and why you support him in his quest to become president-elect this year.
Well, thanks for asking that question. You know, I see our profession facing a very significant amount of change in the next, say, 5 or 10 years and beginning now. And some of that change relates to the COVID environment that is moving things forward on the digital frontier. And some of it relates to our dire economic conditions that we'll probably be facing across Canada. And some of it relates to just the exponential change in quantum computing that will inevitably impact the practice of medicine. And I feel these changes are will be unyielding in their ability to require us to adapt to them. I don't think we'll have a choice, and I think that we need to be ready for that. I think Michael has a large amount of experience in the tech field. He has a vast experience in leadership, ranging from the local scene here in Calgary to the provincial to the national. He's well known and he understands how to make change happen on all of those levels. I really feel we need to prepare our profession for what's coming up. So when I think about that, I think, well, you know, he can jump into a position like that and hit the ground running. Because of all of his skills.
Okay, and Michael, maybe you can chat a little bit about that, just about the why you're doing this.
I think, Mario, from my viewpoint, I've kind of obtained the background and the skill set that's required for the top position in Canada for a physician. I think it requires a mind that has business and business experience. It requires a mind of leadership. It requires a mind of inclusion. And you have to really know the issues over time and how they evolved and how their history is. And not only from your individual province point of view, but really from a Canada-wide approach. And you really have to understand what's happening in the Maritimes and in East Canada and all the way out to our West province. So it really is one where it requires that background. And I feel like I'm almost been training for this for the last 15 years.
Okay, super. Christine, when you look at Michael and you look at some of the key attributes and strengths that he has, what are some of those that you see that will, you know, from a personal perspective, what kind of qualities does he have that will suit him well in this role and in this position?
So I think Michael has so many strengths that I think on the immediate face of it, when you just look at Michael and you look at his career and you look at all the things he's accomplished, he's highly accomplished. You think, oh my God, what a strategic guy, what a builder, what a learner, what a innovative, creative individual, what a powerful individual. And those are all very native strengths for Michael. But, you know, the thing that I notice the most is his compassion. So as a human being, he never leaves that place of compassion for others. And he brings it forward. It's always present in all of the interactions I've seen with him. And I've been involved, I've known him for a long time. He's always there in a very open, compassionate, kind. He's generous with his knowledge. He's inclusive. And I believe his strongest strength is that humanity, that compassionate nature that he brings to everything he does.
Michael, why is that important to you?
No, I think it's an open arm welcoming for all those that want to get involved in issues. So for me, I think kindness leads to inclusiveness. I think compassion is an open door policy really in itself, where people feel like they're welcomed at the table. And Chris and I have talked about leadership, and I think hardly anyone remembers what a leader did, but they certainly remember if they were welcomed at their table. And I think I go by that philosophy. It's one of those things where if you really want to accomplish things, you have to surround yourself with people that are going to help you accomplish it. And that's what I think I'm really good at.
Okay, super. Last question for you, Christine. When you look at Michael and his track record when it comes to mentorship, especially for women in medicine, and also for inclusiveness in all different categories, gender, etc. What can you tell me about Michael and what he brings to the table in that area?
Well, from my own personal experience, I'm very grateful to have had Michael support me during this very difficult year as president that I just completed. It was a very difficult year by all accounts. Everyone at the AMA and most of our profession would acknowledge that. And Michael has been there helping us at the provincial AMA level, but also helping me personally. And as a woman in medicine, I've experienced in my career various difficulties that are just native to the gender and not the gender not having reached a full equality at this point. Michael's always been very open, very supportive. And, I very much approach other individuals as people, not for any other character. And Michael's much the same way. He, when you're with Michael, you don't feel that you've been pigeonholed in any way. You feel that he approaches you for the individual that you are. And I'm very grateful for that. And I try to emulate that in my own life as well.
Mm-hmm. And Michael, why is that area so important for you in inclusiveness and diversity in medicine?
I think the simple answer, Mario, is that it leads to a better world. We can show evidence in medicine and in business that when we have diversity and inclusion, that the results are better. We do better for our patients in medicine. Businesses do better for their bottom lines, their revenue, their return on equity. So I think across our whole culture, this notion of EDI and inclusiveness really has to kind of take hold, and people grab on it and make our world a better place. And I'm more than happy to be part of that, and I'd like to be part of the leadership towards that. So we'll get there. We just need a better world.
Okay, super. Well, thanks both of you for joining us today.
Thank you so much.
Thank you, Mario. Yeah, that was great to chat with you.
Okay, super. That was Dr. Christine Molnar, who was the immediate past president of the Alberta Medical Association, and Dr. Michael Giuffre, who is the Alberta nominee for the president-elect position with the Canadian Medical Association this year. This has been Health Insider with Mario Toneguzzi on Megapix Media. Thanks for joining us today.